Okay, this is my audience. Hi, my name is Erika Sosa. I am doing this informative speech about leukemia. It is very important to know the different types of leukemia and its symptoms to detect it as soon as possible to get treatment for it. Leukemia is the most common cancer among children. Every year, 2,000 to 3,000 children are diagnosed with leukemia in the United States. Leukemia is the #1 death in children than any other type of cancer. It has a significant effect in our society, and it doesn't only affect the child who has the disease, but it also affects the family and everybody surrounding the child. Today I will inform you what leukemia is, the 4 types of leukemia, the symptoms of leukemia, the treatments for leukemia, and the causes of leukemia. First, let's begin to explain what leukemia is and how it is produced in the body. Leukemia is a cancer in the bone marrow. It is a cancer of the white blood cells characterized by uncontrolled abnormal white blood cells that are produced in the bone marrow. The abnormal white cells crowd the bone marrow and flood the bloodstream. As leukemia progresses, the cancer interferes with the body's production of other types of blood cells, such as red blood cells and platelets. As a result, this can cause anemia. Anemia occurs when there are low numbers of red blood cells in the body. Now that we have a better understanding of what leukemia is, let's look at the different types of leukemia. There are 4 types of leukemia. The first type of leukemia is chronic lymphocytic leukemia. It is also known as CLL. It affects the lymphoid cells grows slowly. The second type of leukemia is chronic myeloid leukemia. It is also known as CML. It affects myeloid cells and grows slowly at first. The third type of leukemia is acute lymphocytic leukemia. It is also known as ALL. It affects lymphoid cells and grows quickly. The fourth type of leukemia is acute myeloid leukemia. It is also known as AML. It affects myeloid cells and grows quickly. Knowing these types of leukemia can help you determine how severe the disease is and what kind of treatment you will need for a certain type of leukemia. Next, let's look at the symptoms of leukemia. There are many symptoms that a child has when they have leukemia. The children have pale skin, and they also tend to have red dots on their skin as well. Their skin becomes very sensitive and will bruise easily. The children have poor appetite and become very weak and tired and sleepy, and they don't want to do anything, not even play. So it is really important to look at the symptoms. The children will also bleed excessively, and most frequently they will bleed from their nose. The children will also have fever and infections that will not cure easily, and it will take a long time for an infection to go away. These symptoms may go away, but when they come back, it's worse. There are treatments for leukemia, and it's very important to get treatment right away. There are 4 kinds of treatment for leukemia. The first kind of treatment is blood transfusions. Blood transfusions are done when a person is low on blood components. The second kind of treatment is chemotherapy. Chemotherapy is the use of chemicals, medicines, and antibiotics to kill cancer cells and prevent them from dividing and growing. Chemotherapy has many side effects, which are hair loss, nausea, vomiting, increase of risk of infections, and it will have occasionally bleeding. The third kind of treatment is radiation therapy. It's high energy rays to shrink tumors and keep cancer cells from growing. The fourth kind of treatment is bone marrow transplant. which healthy bone marrow is introduced into the child's body. These kinds of treatment can help cure children that suffer from leukemia. Last, let's look at the many ways that children can get leukemia. There are many causes for getting leukemia. The first cause is radiation, which can be medical diagnosed equipment such as X-rays. The second cause can be chemical exposure. Children born to parents that are employed in occupations containing chemical exposure, such as benzene, increases the risk of leukemia in a child. The third cause is previously chemotherapy for treatments for another type of cancer. Children who had previous chemotherapy have a higher risk of developing leukemia, usually within the first 8 years of treatment. The fourth cause is children that have a genetic problem. Children who have Down syndrome have a higher risk of developing leukemia. Leukemia can be prevented by avoiding radiation and chemical exposure. So it is very important, if you are pregnant or think you may be pregnant and you go to a doctor and they may need to take an x-ray to let them know. These are the main points about leukemia. The 4 types of leukemia, the symptoms of leukemia, the 4 kinds of treatment for leukemia, and the causes of leukemia. Leukemia is a malignant disease in children. Children who are diagnosed with leukemia should get treatment right away to prevent it from becoming more severe. With proper care and treatment, any child can fight against leukemia. Together, as a community, we can support all the children who have leukemia and help them fight the battle against leukemia. I have listed much information about leukemia, so now that you know more about it, you can use it to help others understand what leukemia is and how it is produced in the body. All this information I have given you is also available at the following websites: kidshealth.org, medicinenet.com, childrensleukemia.org, and leukemiaweb.org. Thank you.